Hello, all, and welcome to the Art and Mind Village Chat. I'm Fred Johnson, artist in residence and community engagement specialist here at the Straz Center for the Performing Arts. I'm excited to be with you all again, along with my co host, Miss Karen Alexander, Director of Outreach and Education for the Art and Mind Lab at Johns Hopkins University, and also a key member of our Art and Mind Village chat team as we plan and coordinate these opportunities to come together and talk about the importance of art as a modality for health and well-being and healing. And we are really, really honored to have with us today Mr. Eric Holmgren from the Massachusetts Cultural Council. Eric, thank you so much for agreeing to come and be a part of this art and health conversation.
Of course, thank you for having me.
So, Karen, I give full credit to you and your colleagues at Johns Hopkins as we began to move our conversation now. And as many of you know who have been with us for the last few seasons, we've really moved through an iteration of artists coming together with science and research to more broadly understand what so many of us, and even when we take a look at history and sort of the indigenous threads of the utilization of art to help communities feel better and help communities come together, that body, mind, and spirit journey, we are so excited to move to a place now where some of these natural innate things that as artists we've known and felt, we are in alignment with and collaboration with our science and research community to say, so this is what's happening to the brain, this is what's happening to the body. These are important components in our mental and physical well-being, the well-being of us as individuals and the well-being of our communities. And so we have been so amazingly guided by you and your colleagues at Johns Hopkins, Susan Magsamen, who is really the reason why we were led to understand. So here's the story, and so this is how you tell it. And so we give so many kudos to all of you. And when we began to talk about prescription and how do we prescribe, now that we've got this knowledge and this information, how do we move it into a network and into the community and into places that work? And who can we really be in touch with and talk to about this? And you unequivocally said, you got to be in touch with Eric. So we got in touch with Eric, and Eric, we're glad that you're with us. Karen, in terms of some of the work that's happening, at the Art and Mind Lab relative to prescription, what are some things that we can share as we begin to have this conversation with Eric?
Sure. Well, thank you for that lovely introduction, Fred. Susan and I are so happy to be working with you and the Straz team. So the way we initially got connected with Eric in terms of our research projects is that our research director, Dr. Tasha Golden, was involved with a seminal report looking at outcomes from the Mass Cultural Council's program around arts and prescription. In the UK, social prescribing as a broad kind of policy and practice has been happening for quite some time. But here in the States, the idea of prescribing arts-based experiences as a way of helping people with their health and well-being is a relatively new concept at a state level. And so Massachusetts and the Cultural Council have really been leading the way nationally on that. So we at the lab, through Dr. Golden, we're thrilled to be able to be a part of that study. And she continues to collaborate with the Cultural Council around that work.
Fantastic. So, Eric, I think many folk, when they hear the Massachusetts Cultural Council, most people and they think of it administration. You know what I mean? But please share with us your work at the Massachusetts Cultural Council and how you found your way into this pathway of prescription.
It's a great question, how we found our pathway. The Mass Cultural Council is a government agency for the Commonwealth of Massachusetts. We're an independent agency, which means we have a council that is assigned by the governor, is appointed by the governor, and that is the actual Mass Cultural Council. and we receive an allocation each year from the general fund of the legislature. So we're nearing completion of the budget season for the 2024 fiscal year, and we're looking at approximately $25 million that we grant to local cultural councils and to individuals and organizations throughout the Commonwealth. Our work in Culture RX grew out of a couple of places. For about 30 years, we've been doing work in a field called creative youth development. Creative youth development are programs that infuse the principles of youth development alongside creative practice in the arts, sciences, and humanities. And for 20 years, there was a huge group of programs in Massachusetts that were doing this work, and we're really just calling it this work. And for the 20th anniversary of Youth Reach, which is our granting program in that area, in 2014, we threw a big party. And a government party means we created a policy and advocacy agenda to really grow the field and named that practice of creative youth development. And so as that work evolved, we started looking at all of the different ways that the youth development impacts were being measured, and thinking, these impacts don't end clearly at the age of 18 or at 24 or at some arbitrary point. So as we're thinking about how to expand that work, we met a woman from the Royal Theatre in Plymouth, England, named Mandy Precious, and she first started talking to myself and our former executive director, Anita Walker, about the practice of social prescription that they were implementing at Royal Theatre Plymouth. So we were thinking about, similar things at the time that we came together. And one of the things that's interesting about Massachusetts is that we have this celebrated healthcare system called Mass Health, that parts of it were really a model for Obamacare, and we have a very high insured rate in Massachusetts, but more than 40% of the budget for the Commonwealth of Massachusetts is related to healthcare. It's a huge, huge issue. And so talking with our legislative colleagues and thinking about our potential impact, we launched two programs. One was called the EBT Card to Culture. So this program provided EBT card holders, so the digital equivalent of food stamps and assistance, free or reduced admission to more than 200 cultural organizations in Massachusetts. So you could show your EBT card at one of these organizations, be it the Boston Symphony or a children's museum or anything in between, and receive free or reduced admissions. And we just passed 1 million uses of that EBT card to culture benefit in Massachusetts. And so we're thinking, how could this be extended to Mass Health card holders, or something called Connector Care, which is actually subsidized healthcare for low income residents, which frankly is a lot of artists, individual artists across Massachusetts are in that, and teaching artists. So we were looking at all these things together, and what we ended up doing was working with our legislative colleagues to identify a pediatric care center in the Berkshires that was already involved in some collaborative care work. And finding a community health center in Springfield and piloting this. So we found a lot of legislative enthusiasm for it. This was not something we needed to sell to the legislature. This was not something we needed a whole lot of data about. There was a real intrinsic understanding of the relationship between experiences in the arts and culture and positive health benefits. Fortunately, we were able to correlate a lot of that with the World Health Report that was released around that time, and several other studies. And really back it up. But the ability of our legislative colleagues and organizations to receive this and want to grow with it was really great. So we held a legislative briefing to launch the initiative in early March 2020, and several of our legislative colleagues could not attend that event because they were at a briefing for something called COVID-19, and that clearly turned the tables on that launch. But we were able to persevere with it. And in our first pilot phase, the two organizations, the Community Health Center in Springfield and in the Berkshires, wrote 60 prescriptions, and we've grown since then. So we've expanded that program as COVID has allowed, and as our capacity has allowed, to introduce other partners. And currently we're at 12 partners, 10 of whom are still operating programs in social prescription with different partners around Massachusetts. And we just got our data back from this fiscal year, and it looks like we'll have over 1,000 prescriptions being written in Massachusetts during that time. One of the other things that was interesting, in the rollout of it, and we can talk a whole lot about the implementation, but one of the things that we had thought we needed to do before we launched the program was to do training for care providers, for pediatricians and for doctors and for community health workers and mental health counselors and other kinds of referrers. We call them professional care providers. We ended up not doing any training at all because, again, there was an intrinsic understanding of the value of this. Yeah, even from the pediatric community and the medical community, there was no hesitancy to write these prescriptions for patients where they thought there would be benefit. And in fact, what we found in our evaluation of the program is that it meant as much to care providers to be able to write these prescriptions and provide these opportunities as it did for patients to be able to engage with them. So there's a tremendous amount of enthusiasm for the work. As Karen mentioned, Dr. Tasha Golden has been an invaluable partner in helping us document and really report out on this. We have another report that's going to be released soon that I can talk about later. You know, I think there's really unlimited growth potential for this work at this time, both in the medical community, in the research community, and in the arts community. But there's a lot of work to do to be able to build it, because one thing that I think we'll explore here, and anyone who's done work with social prescription will come to understand, is that the only thing that's simple about the social prescription of artistic experiences is the concept itself. The implementation in every way is so complicated, with issues of partnership and equity and access and transportation and all of the things that have plagued arts organizations for a long time. But it's an incredible opportunity to begin to address those concerns head on.
So it's really awesome to hear you say that you didn't have to really kind of convince folk in the medical community that this was important, and that, you know, that and I, you know, I kind of cut my artistic teeth in Boston, so I have a special affinity for Massachusetts and its connection and relationship to arts. And so I understand a little bit of that. People's leanings are slightly different. My question is, you know, like, as an arts institution, for those of us who, you know, have been a part of this journey, continue to be a part of this journey. And so I guess my question is to let's say a medical organization that one needs to explain to them why this is important and how it can support rehabilitation or, you know, a healing process. What are some of the bullet points that one would say to a medical institution to inspire them to consider prescribing an opportunity for someone to go to the theater? Or what are some of the options? I guess I'm asking.
It's a great question, and I think the answers are as varied as the medical field itself. So the World Health Organization report was remarkable because it encompassed more than 70 studies that engaged more than 370,000 people in the impact of the arts in wellness and social determinants of health and other areas. And so I think the data is there. I'm guessing that a lot of the listeners of this webinar and a lot of medical professionals have never read the World Health Organization's report on the arts and health. That's not what drives them. It's there, but it's not what drives them. So I can describe a few of the reasons in Massachusetts and a few of the things that happened here. One interesting report is from an organization called Urbanity Dance that partnered with an Alzheimer's clinic to create a dance program. And they felt that one of the areas that really needed to be addressed for patients in this program was stability and strength and coordination. And the way to do that was through a dance program that was in place there. Again, there was not a lot of convincing to do. It seemed like something excellent to try. And we started to do that. And we've been funding them for several years, and they continue that close partnership. In the Berkshires, the Clark Institute, which is a phenomenal arts museum, has partnered with a large group of mental health providers in the area to really work on the museum as a place to help alleviate social isolation. The director of public health here in Massachusetts told us prior to the pandemic that social isolation and loneliness can have the same health impacts as smoking a pack of cigarettes a day. And so by creating these opportunities for these people to come out and to engage, not just with art, but with other people in that space, has been a real boon. The Museum of Fine Arts, which is our biggest, well, first, it's the biggest museum in Boston, and it's also the biggest social prescriber in Massachusetts right now. They have a relationship with a hospital where they're sending teaching artists to children's areas of the hospital to help them use creativity, to really help their patient experience while they're inpatients in the hospital. They also have done some really interesting work with physicians and what physicians need to be able to be sustainable in their own practice and in their careers and in their jobs. And they actually have a separate, really interesting program about helping physicians see, looking at art and learning to see different kinds of things. So, I think different people are using it for different reasons. Different organizations are using it for different reasons. One of the biggest challenges in all of that is, again, the logical connection is there, but from the moment you either write the prescription or make the recommendation to the person actually engaging with that experience, that's the biggest gap that we have to cover. Not just in social prescription of arts experiences, that's, accessibility issues in cultural organizations that they've been fighting with for decades to bring new audiences in. One of the things we learned from Mandy Precious at the Royal Theatre of Plymouth was that they found they needed a certain number of engagements with an individual before that individual would feel comfortable crossing the threshold and coming to the theater. So their first attempts at social prescription were going out into the community and meeting people where they were, developing enough trust that person would come in. And we're seeing that play out in social prescription here, where there are still far more prescriptions written than are actually utilized. But those numbers are coming up as the organizations learn and as we learn and other partners learn what's necessary to help really make that transition.
That's really great. I mean, really, really valuable information. A lot of the components that you've spoken about in our work with our colleagues, somebody's doing a little bit of all of it, a little bit of that. And so to kind of bring it together and to build those bridges, I think is really, really, really important. Karen, your thoughts about
Sure. Well, I actually have a few questions about kind of the nuts and bolts part of how everything works. So two that came to mind hearing you talk. One is, how do you know that someone has used their prescription? What kind of tracking or reporting mechanisms are in place? And two, does the prescriber have kind of a menu of options that they can prescribe? Or like you mentioned, there might be a specific relationship between a museum and a hospital. I imagine that could look different in different places, but I'm curious what has been happening in Massachusetts.
It does look different in different places. That's a great point to make. In the Berkshires, the pediatric center that we partnered with was called McAnee Health, and there was a group of 5 organizations, cultural organizations, that were partnered with McAnee Health, and that included Mass Autobahn and the Berkshire Theater, Barrington Stage Company, a number of the museums in the area. So when a doctor saw a patient, they were able to pick, or the patient was able to pick from a menu of options to know what's there. To bridge the gap to get them there was interesting. So the way it was tracked was really by one of the nurses whose responsibility was sort of a patient care coordinator, what we call a link worker. So that link worker was probably the most essential piece of the puzzle in terms of communicating both with the family and with the organization. And that link worker before each year would go and visit each of these organizations to be able to provide the patients with a clear understanding of what was happening and what they needed to do, what they needed to be aware of, how they needed to go. And then the organizations themselves could be prepared by recognizing they needed to have translation services or accessibility services and those kinds of things in place. Our tracking was a little rudimentary, but it was a massive spreadsheet that we were able to have each party, both the medical provider and the museums and arts organizations, report to. Some organizations used a more sophisticated tracking mechanism. So one program at the zoo, at the Franklin Park Zoo in Boston, sort of right across the street from the Harvard Street Medical Center, And what they were doing was providing season passes, so year-long passes to young mothers who had completed their postnatal care, and if their young people had completed the vaccination cycle, they got a year's subscription to the zoo. And so what the zoo was able to do was somehow classify that prescription so that when it was utilized to enter the zoo, they would be able to track it separately. COVID wreaked havoc on that program, but there's different mechanisms for that. We've also been working with a new partner called Arts Pharmacy, who does a lot of work in Georgia and is really growing a business across the United States of doing this work. They have other kinds of mechanisms that are really comprehensive in terms of the link worker and tracking and sort of systematizing that whole process. And so we're really, really interested to see the kind of growth that can come through a partnership with Arts Pharmacy in the future to really collect as much data as we can and increase that effective usage number, because that's really where the impact is. Lots of prescriptions can be written, but if they don't go, none of this matters.
Eric, I want to ask this question because it's probably been the number one thing that people have said to me when I've, just shared the work that we're doing, shared the fact that we're coming together to really, actualize and apply and utilize the arts in new and innovative ways, especially from a prescriptive standpoint of view. Number one question, who's going to pay for that?
Yeah. And that's the sustainability question that we think about a lot. So in the model in Massachusetts, as we started it, the Mass Cultural Council sort of positioned itself as almost like the insurance company payer. So we funded organizations to develop capacity, staff trainings, all the things necessary on their end to do it. And then we reimbursed every prescription that was utilized. So we would cut a payment to those organizations for the prescriptions that were utilized. In year two, we stepped back and said, this is a lot of administrative work, both for us and for the organizations. And we funded a flat rate for a certain number of prescriptions. And that made the process a lot easier. And that funding was unrestricted programmatic funding. So they could use it for whatever purposes they needed within the social prescription program that they were running. In the future, I think, again, Arts Pharmacy has a very interesting model. And the future of this, the future of social prescription, and frankly, the future of a lot of arts funding, I don't think will come from the arts. It will come from the sectors that the arts have impacts in, one of which is health and wellness. And so as we think about payers, we can think about insurance companies, managed care providers, union health plans and health benefits and things like that. We can think about public funding for all sorts of different kinds of health outcomes, specifically around social determinants of health. We don't have the data for that yet. So I think in the next few years, we'll be partnering with an organization to help us scale this. We've decided we're not the right organization to scale this. We're not a health insurance company. We're an arts council and we're a government one. So we're going to be supporting another entity to come in and really explore that question with a couple of years of funding. And our funding will sort of, I'm a musician, so I'll say decrescendo. It'll taper off until such time as they're sustainable on their own by identifying who these other payments are coming from. So I'll have a really good answer for you in about 2 years, but right now I just have a sort of roundabout one.
No, that's so great, really helpful. I think, I mean, a lot of these are the kinds of things that it's important for all of us to wrap our heads around. And one would hope that that there might be one of our donors, listening to this this village chat, who can more broadly understand. I know one of the advantages that we have is that there is a real alignment now between folk who are experts at researching and who can really compile data with creatives, so that as we move forward, I mean, we can quantify that these outcomes are real. This is not just a felt thing. which would have
Right.
been okay for me. but the old just the facts, ma'am. That just that concept. So here are the facts, and here's the intentionality to really move this more broadly. Um, we all know that it feels like the scope of mental health challenges have amplified since the pandemic. Um, in the work that you're doing, is there more effort, or is there a sort of a focused effort towards taking a look at how this effort to prescribe can really, really help in the mental health arena?
Yes, that's the most acute issue, and arts pharmacy in particular is focused on that issue as well. So I think one thing that's important here is there's an opportunity for the funding community, for the arts to take a risk and have a vision. One of the things we talk about a lot in arts funding, probably too much in my own personal opinion, is the creative economy. We talk a lot about how many jobs the arts create and how many dollars it creates, and tax dollars and revenues. What we don't talk about is the other side of that, which is the cost savings that happens because of the arts. And social prescription falls directly into that. We have data that says young people who are in our creative youth development programs, that are also involved in the Department of Youth Services, which works with incarcerated youth and court-involved youth, like there's lower recidivism rates. Young people that are involved in the Department of Mental Health and creative youth development programs, are getting services from these arts programs that would be otherwise paid for by the government in these other mental health programs. So social prescription, I think, amplifies that argument exponentially, where the cost of intervention is so low to do this work, yet the impacts to personal and public health are tremendous. We don't have that data at scale. We're not going to have that data at scale unless there are some, again, risk-taking, visionary kinds of funders out there that will invest in this so that we can operate these programs and collect that longitudinal data and that impact data. The arts community as a whole, we struggle to fund research. Period. Karen, you probably know all about that. And I don't know how to fix that. As a part of the arts funding community, I'm baffled by it. But in the medical community and in public health, there's a lot of investment in that work, because those research grants produce solutions that can be scaled and implemented in really interesting ways. So I think this act of social prescription is an opportunity to really begin to tap into that and then to grow it. And our sincere hope, and one of the reasons we've partnered so closely with Dr. Tasha Golden, is to be able to be a part of that solution, even though it's a very small part right now. Coming out soon will be something called the Social Prescription Field Guide, that I've just seen the first draft of, and it's outstanding. That was authored by Dr. Tasha Golden and supported by the Mass Cultural Council and the University of Florida. And that guide will sort of give organizations, the research foundation, some case studies and recommendations for implementation of this work that don't exist. Like it's this conversation that we're having now that will be broadly available to a lot of different kinds of organizations. One of the things that's going to be unique about the United States implementation of this is it's going to be local and it's going to be varied. It's going to happen in different forms with different disciplines and different partners. And so, the more we can at this early stage wrap our heads around that aggregate and start to make sense of it, the better it will be for longer growth and scalability in the future. I'm not sure if I answered your question, but I made a point that was really important in my own.
No, you did. I think you did. Yeah. Don't you think so, Karen? Yeah.
Yeah, I do. And actually, you mentioning that, it was one of the questions I was thinking about was, it sounds like you got some great insights from the folks in Plymouth, England, but knowing how the NHS there is such a different public healthcare model than we have here, I'm curious how the lessons learned from the UK can be translated, not only in Massachusetts, where again, you've got the closest thing I'd say that the United States has towards a UK style health system, even though it's not the same.
Yep.
Thinking about a state like where we are located in Maryland, which is pretty progressive on health issues, but we certainly just have, our federal system of Medicaid and Medicare and then private payers. I don't know if there's any low-hanging fruit within all of that, but I'm curious what you've been seeing when you hear from
Yeah,
is.
it's a very good question. The definition of insanity is doing the same thing and expecting a different outcome. And so one of the things that we are recognizing is that changing the healthcare system is even harder than engaging with people. And so when we look at the national health system in England, and there's a museum in Canada that's been doing this for quite a while as well, and that's more similar to England than here. Even Massachusetts to Maryland, very different. And within Massachusetts, the care providers that we're having are very different. We spoke with the president of the Community Health Association in Massachusetts, and what he kept saying to us was, if you've seen one community health center, you've seen one community health center, and all the rest are different. The common denominator across all those places, whether it's Canada, whether it's the UK, whether it's Maryland, whether it's Massachusetts, are the people that need to engage with these services. And so our emphasis has really been on understanding how cultural organizations can successfully engage with patients who are referred. We do not have the capacity, even in our position in government, to have any significant impact on the direction of health policy in Massachusetts, at least not at this stage. But what we can do is aggregate practices that have helped this become effective, and really bring it in, and taking all that sort of varied terrain, and finding the shared truths that are in there for people. And I think the first one is trust. People need to trust the cultural organization and trust the care provider. That's where community health workers are so important. Not even as much as doctors, where the community health workers are the people who know the individual and the family and the community, and what works and what doesn't work. They may know the language where others don't. So, I think building trust and understanding the ways to effectively build trust in these circumstances is a big first step. Something as seemingly simple as transportation is a second one. Getting people to these places. There are a lot of cultural organizations that are not situated in the communities that are the referring providers. It's just not. There's a huge barrier, especially in rural areas, but even in urban ones. So trust, transportation, and then I'll call it like the feeling of inclusiveness at a museum. Like, we have quotes from families who went to museums and they were blown away that they felt welcomed, because they always thought this was not for them, right? This was not. The Norman Rockwell Museum is not necessarily representative of all the people of Massachusetts, right? But there are ways to create it and have it be a more accessible place. And so there's a dialogue that's happening between the organization and patients, and they've made some substantive changes at that museum now to be able to do that better. So, I think, as we're thinking about the differences in health systems, we're not spending as much time there, but we are spending as much time as we can on that piece that seems common across all of the countries and all the communities that we're working in.
I think that one of the realities too is just people's perception of art. I a number of years ago was involved in a project where we were really, the intentionality was to use art in all of its forms in various places in the world that were conflict zones, where people found themselves in conflict. And so the intentionality was to use the art to create a palette of safety, where people felt like if they were engaging in a musical experience that didn't have a lot of lyric that was guiding them to, decide something, but that they were in a melodic situation where people were singing together, where people were in a creative space together, using that aesthetic muscle and moving from their heads more down towards their hearts and a place of commonality, magical things can happen. And one of the directors said, well, what's the end game here? And I said, really, to kind of redefine the understanding of art as a catalyst for joy, but as a catalyst for transformation. I mean, we just did a presentation 4 weeks ago for 700 healthcare workers for the Tampa Health Department, right? Hillsborough County Health Department, all the field workers, everybody that did anything relative to health. And the message was, come and let's let's find some commonality. I mean, first of all, healthcare workers, doctors, nurses, people who are in the health community are overworked.
Hmm.
I mean, people were exhausted. So, we created song for them. We created an experience for them where people said, man, you know what? I didn't come here expecting to sing, but like, I haven't felt this good in such a long time. So I think, you know, we still have an opportunity to expand the understanding of art, that it's not just an industry where you have to pay a whole bunch of money to go see a concert or a whole bunch of money to see theater or whatever, that it's an integral part of what helps to define our highest level of humanity.
Hmm.
And so it still feels to me like, for instance, when the pandemic hit, I was doing some online teaching to theater students, and many of them said, "Well, I don't even know if I should be doing this now. I mean, I mean, is this even really important? I mean, look, the whole world is shut down." And I said, now more than ever, we should be doing this because we're needed. We're the link. So I think that that's a big part of it. Is kind of, the medical world has been over here in their silo, and artists been trying to find a gig, and so to create a new opportunity for the creatives of the world to recognize the amazing giving, the amazing contribution, the amazing bridge that we can be to health and well-being. And I think one of the most important things that happened when we did that program for the health department is people said, thank you, man. Thank you for today. And I want to know more about this art thing.
Yeah.
So I think, God bless Massachusetts for you guys, having folk that are on board. But I think there's so much connective tissue that's got to happen. And I mean, every day of our lives, we're in surrounded by conversations of division.
Hmm.
We're talking about really coming together. I mean, I wonder your thoughts about that. I mean, Karen, how easy is it to engage artists? Do you feel like the arts, even the arts, because we talk a lot about, well, the general public doesn't know how valuable, but I'm not sure that creatives that we've been guided
Mhm.
towards that. I think we've been guided towards career,
Yes.
and health and well-being has not been a part of the conversation. We might say, I remember saying for years, if I don't sing, I'm going to die, right?
Mhm.
But I never thought about, well, maybe my singing could encourage somebody else to open up and be healthy and not die, you
Mhm.
know.
And I think there's also the issue of compensating artists for their contributions, which of course comes up in the artistic field, but also if we're looking to them now to also be understanding the health benefits and maybe communicating about those as well to their audiences. I think the idea of reimbursement is really appealing because it would be wonderful if the people who are doing that work were able to have a more reliable source of income for it as well. And that's where I know there's a long way to go, but if there was some parity around reimbursement for people who are doing work in arts and health, that would be phenomenal.
I think your point's well taken, and I do believe a part of it is to behoove all of us to have that kind of conversation, because uh, value is an interesting thing, perceived value. I think for many in the medical world, it's a really wonderful thing to have somebody, come sing, play some music at someone's bedside. You know, I think that the more finite journey between artists and folks in the healing, medical world, having common conversations around how those can work together. In other words, I think we have to raise the value quotient, in terms of folk understanding. That's why I think some of the science and research that we can offer now, it expands people's understanding that art is not just a feel good thing. And that ought to be enough. Or the feel good, let me say that art is a feel good thing, but the feel good stuff has got some, melatonin and some, you know, it's got
Lots
some
of
natural
vitamins in
chemicals that creation has
it.
given us that, we can tickle and awaken so that
Mhm.
you'll feel better. Eric, what would you say if you had to say to folk, look, here's the here's the starting point. What do you recommend to people? How do we start this? What do we do?
Co-creation. I think that there's a real impact. We saw this in Springfield, again, back to this idea of building trust with communities. Is the first thing that happened was, I think Community Music School of Springfield went to the health center and started creating programming in one of their spaces, because the community already had trust with the community health center. And it was not about like going to a museum and just seeing art. It's about creating art. So all of the feels that you just described, all the things that we need as humans, it's really from creating art, not just consuming it. And
Yes.
so I think a great place to start is in that co-creation, because there are things that, whether we call them untrained artists, that there are stories that are out there to be told that just don't see light. And communities also bring in those cultural experiences in different ways. For some communities, it's about cooking. For some communities, it's about visual arts. For some, it's song and storytelling. So creating the spaces where, taking it's like an asset-based approach to that. So you're not inviting people in and saying, you don't know how to do this, so we're going to teach you. It's saying, you do this, let's do it together. I think that's a great way of building trust. But the other bigger issue that I think you're illustrating is I feel like the arts has a narrative problem. Like we don't have a good publicist as a huge arts community, right? We all tell different stories in different ways. And, even all the studies that say if you are in music school, if you have music in high school, you get better SAT scores, like just not true. Because when you control that data for socioeconomic status, it turns out the kids who are getting higher SAT scores are the ones who already have 18 other advantages at the same time, right? So we've kind of blurred this line between research and advocacy in a dangerous way. And so I think the act of social prescription really gives us an opportunity to tell this story that resonates most deeply within us about the arts, that it does make us well. It makes us feel good. It makes us healthier, and that's measurable in some way. It's not something the Mass Cultural Council can measure, but it's something that Tasha Golden can measure, and others at Johns Hopkins and other institutions. That's where that community comes together. We can measure and then even put a dollar amount on that tingly feeling you get, because it has an impact on public health. It has an impact on personal health, and we're just not there yet.
Yeah, expanding the concept that it takes a village. I think you're absolutely right. I think there's a lot that we can continue to learn from each other. I think that collaboration is really, really important, because it's never been approached in this way before. But I believe, and I know the folks here at the Straz Center believe, that this is one of the most important contributions that we can make in the health and well-being of our communities, to
Absolutely.
regain a sense of our humanity, and to know that everyone is a vital part of the art of living. I have a colleague who's a great musician, and he does a whole thing on the making of bread. And so combining the making of bread, the nurturing and making of bread, and aligning that with music and with song, and taking what people are thinking about. So all of these elements, how can we expand our understanding of the medicinal impact of the aesthetic journey? It's a very, very important part of the partnership of being well, staying well, helping communities to heal, and having a shared conversation. I just want to go on record, Eric, saying, man, thank you. We want to definitely stay in touch.
Absolutely.
Again, Dr. Golden is very much a part of the, of the art and Mind Lab, the Village, the Johns Hopkins work, all the work that we're doing together. And this is a collaborative effort. I say we stay in touch, and
Absolutely.
keep doing updates. And I mean, listen, it's rare that and I do a lot of Zooms. It's rare that I go onto a Zoom and I am visited by someone who has as an amazing reach and understanding, and his background is a for real piano. You know what I mean?
That's my wife. She didn't ask me to play, so
so that feels really, really great. Karen, any final thoughts as we
No, just we're very excited about the forthcoming field guide. We'll be sure to be sharing that through the International Arts and Mind Lab website and newsletter. And Eric, just really appreciate you making the time for this. I think it's hopefully the first of several conversations to come, and we'd love to stay up to date on what's happening in Massachusetts.
That's great. Yeah, and we could not do any of this work without you. So I really appreciate all the contributions that have been made, and then the partnership that's to come. And same with the Straz Center. If there's anything that we've learned here that we can be, of support in, we're a public agency for the Commonwealth of Massachusetts, but there's solutions outside of Massachusetts that are great here, and we want to make sure that everything that we've done and learned can be publicly available, because it has a tremendous potential in the future.
Absolutely. And I think you really kind of, our final acknowledgement is, we can't do this without you. Those of us who are on the journey, it's a tapestry, it's a canvas made up, a tapestry of many threads. And one of those threads is the opportunity to continue to just inform and inspire our general community, folk who love the arts, folk who are involved in research and medicine. Everybody wants what's good for all of us. The intentionality to really, really create that, to grow together, to learn about what we don't know and learn about that and co-create. I think co-creation is so very, very important. So Eric, thank you for all the work that you do. Thank you for taking the time to come to the Village Chat. Karen, as always, thank you for all that you do with our team and your spirit and commitment to this work. You really, hold that mantle of the educator too, and you're taking it to the people, and we so appreciate that. So thanks to all, and thanks to everybody who joined us again for sharing one of your most valuable commodities, and that's your time. We are happy to be a part of this journey together. And again, we can't do it without you, because we just be in a bubble here without your ears and your hearts and your understanding. So on behalf of Johns Hopkins University and the Straz Center for the Performing Arts and the Massachusetts Cultural Council, I'm Fred Johnson. Until next time, take care, experience some art, stay healthy, and we'll see you again soon. Take care all.